Hey everyone, welcome back to Nova Pain and Rehab Center. So today we're going to continue with our core stability series. Today we're going to talk about some movement for the midline core, for flexion and extension of the torso. The two movements we're going to be going through today are called the bird dog and the dead bug. Now these are very common, very common movements that we use in physical therapy to strengthen the core. They're going to incorporate a number of different muscle groups, and there's different alternatives that we use with this, but this is definitely a foundation for a lot of the movements that we do. So let's go ahead and get into some anatomy, and then we'll go ahead and demonstrate the movements for you, okay? Okay, so here we have, this is the back. There's a lot of muscles through here that we work on. The main ones we're going to talk about today are the retrospinous series. This is called the longissimus thoracic, and you can see it runs all the way down the back. And then beside that, you have the iliacostis lumborum, which deals with extension and some rotation. It attaches to the ribs, you can see there, along with the external oblique. So there is some rotational components to that one. As we get deeper into this, we've talked about this muscle before, which is the QL, or the quadratus lumborum, which again is another rotator and kind of midline stabilizer. We do a lot of work with this muscle. Coming up the back, we have the rhomboid, which is again a very common muscle that we work with. It attaches to the spinous process of the spine, then the interior or medial border of the shoulder blade. So with a lot of shoulder conditions that create fixation or instability to the shoulder blade, this is a muscle that we do some work with. And above that, we have there's the serratus posterior superior, which is again a very common muscle, especially in people who sit for long hours, because this is a stabilizer for the base of the neck that attaches to the top of the shoulder blade. So we do a lot of muscle work with this one. Okay, so let's get into the movement. Again, this is called a bird dog. So again, the quad position. The first thing you want to do is lock the core down, and we do this by pushing the belly button to the spine. We're going to lock that core in, and then we're going to contralaterally extend the arm and the leg. We're going to extend the arm all the way up and the leg all the way back. With the leg, you want to really focus on contracting your glutes. Really squeeze your butt together, get that leg up, and then on the arm, you want to fully extend that leg, try and reach to the front wall. You're going to feel this the contraction of the muscles through the shoulder blade. Usually we recommend holding this movement for about 8 to 10 seconds, and then bring that down into a position. Relax the core. You let that go, and then again, contract the core, belly button to spine. Other leg and other arm up. You see, we're going to hold this for about 8 to 10 seconds. Head, you want your head in a neutral position. You do not want to be looking straight down or straight up. You just want it in a relaxed position. We will go back and forth with this for maybe 6 to 8, 10 times until the person starts to fail. And they're going to fail by not being able to fully hold their arm and leg up in a straight line. Once the leg and arm starts to fall, then they're going to be done with that side. Okay? All right, very good. That's called the bird dog. So let's get into the next movement we're going to demonstrate today, and this is called the dead bug. So we're going to be working on the trunk flexors now. This is the rectus abdominis muscles. These are the 6 or 8 pack that we usually see. Underneath that, we're going to have the transverse abdominis muscles, and these are going to also work on trunk flexion as far as a little bit of rotation. Underneath that, we have, way in the back, is the psoas, which is a very common muscle that we treat a lot in here. It's if you look at this position, you see this is all the way through the back. But it's a very important muscle, and this will be also engaged in this movement. Okay, so now we're on our back. First thing we're going to do with this is really lock down the core. We're going to do that by pressing the belly button to the spine to flatten the back out. Arms and legs up, and then on a contralateral, opposite leg and opposite arm, we're going to take that down and back. We're going to hold that for about 8 to 10 seconds, and then we're going to bring that back up. And then the opposite side here. Okay, so again, we're working a couple different muscle groups with this. If you do have pretty weak abdominal muscles, you probably won't be able to do a whole lot of these. The modification for this is you can put the legs or the feet on the ground. Just put the feet down. arms still up, and just bring the knees up as the arm goes back. Yeah, there we go. And will be a little bit easier to do, just a little bit easier modification. And this will be a building block to eventually be able to get both those knees up and come back down. Okay, so again, maybe about 6, 8, 10 times each side. As you go through these movements, don't forget to breathe, because you are locking the core down, so sometimes people just simply forget to breathe during these. All right, excellent. Okay, and that is the dead bug. Okay, thank you. Okay, so 2 really simple, easy movements, really good movements for midline core. Again, requires no equipment, can be done easily at home. As we go through the different series, we're going to be hitting different elements of the body and stuff that you can use in conjunction with each other. We'll start to move our way up the back. If you have any pain with these movements, either in your back or your hips or your neck, change the position first, and if it continues, it may not be the best movement or position for you to do yet. If that continues, of course, you can give us a call and let us know. These are things that we help to treat. If you need to reach us, you can reach our Arlington Clinic at 703-535-8887, and our Purcellville Clinic location at 703-376-3797. You can also reach me directly through our website. There is an Ask the Doctor tab on both the websites for both locations. Those emails come directly to me, and I'll always get back to you with an answer. If it's something more complicated, then we can discuss maybe coming in to take a look at you. So I hope everyone is staying healthy and strong and flexible. We look forward to talking to you again. Thanks.